We evaluated the effect that the provision of care that is considered futile or not beneficial to patients has on the experience of burnout among nurses working in critical care units. Futile care is care that does not improve the condition of a patient, the quality of life, and chances for survival. Burnout has been largely studied by sociologists and psychologists. And one component is emotional exhaustion. Emotional exhaustion relates to the healthcare provider or the professional experiencing that the resources or the patient's demands exceed the resources, the emotional resources. The second component is a sense of the personalization. And then a sense of the personalization relates to the feeling that the patient, they're just providing care without any regard. In terms of providing patient care, it affects the quality of care that one can provide. It does not meet or it's not in agreement with what you view with your values and beliefs about what should be done for the patient. We use 2 hospitals. We serve nurses in 2 hospitals, and we had a total of 60 critical care nurses. Education was directly associated with the experience of burnout. Nurses who had a bachelor's degree or a great higher education experienced greater burnout than those who had an associate's degree. Rotation versus no rotation between the units. We found that nurses who rotated between the critical care units experience less feelings of depersonalization. Being religious may buffer what comes to us, the experiences, the negative experiences that lead to emotional exhaustion, burnout, or that distress us. In terms of recommendations, probably we could say addressing at the unit level what can be done and at the administrator level, at the hospital level at large. At the unit level, it may help to provide critical care nurses with some kind of counselor or a leader that can facilitate conversations and discussions on this, an expression of these feelings. Other interventions, administrative level, could be nurses to serve in boards frequently in these ethical reviews. I am interested in looking at health system factors that may contribute to burnout, as well as health system factors that may prevent or that may influence the experience of burnout.